Today's story is about a woman who arrived at an emergency room with symptoms doctors had seen before. At first, it looked like a severe medical crisis, but still the kind of crisis an emergency team knew how to handle. A racing heart, trouble breathing, a very sick patient who needed help fast. But then, the people treating her began getting sick too. And by the end of this episode, one detail inside that room will completely change the way you understand what the emergency really was. This is The Body Files from the SCP Labs podcast. Let's get into today's story. On the night of February 19, 1994, the emergency room at Riverside General Hospital in California stopped feeling like a hospital. Patients who had come in for broken bones, chest pain, fever, and the usual emergencies were suddenly being moved out of the building and into the parking lot. Nurses pushed beds through automatic doors. Doctors stepped outside under the harsh white lights. People who were already sick were wrapped in blankets while staff tried to figure out where to put them, because the place that was supposed to be the safest part of the hospital had suddenly become the place everyone was being told to leave. Inside the emergency room, a woman was still lying on a trauma bed. She was 31 years old. Her name was Gloria Ramirez, and around her, the people trying to save her life had started collapsing. This story is called The Night the Emergency Room Collapsed. Earlier that evening, Gloria had been at home in Riverside. She had been very sick for a long time. Gloria had advanced cervical cancer, and by February of 1994, her body was already under enormous strain. But even then, the people around her had reasons to see her as more than just a patient. She was a daughter, a sister, a mother, and someone whose family did not think of her as a mystery or a headline. They thought of her as Gloria. That day, Gloria was nauseated and vomiting. She felt weak. Her body was not acting right. At first, even that could be explained. When someone is already fighting cancer, there are many reasons they might feel sick. Medication can do it. Pain can do it. Dehydration can do it. The cancer itself can do it. But as the day went on, Gloria's condition became more frightening. Her heart was racing. Her breathing was abnormal. She was confused. By the time paramedics arrived, this was no longer a situation where anyone could wait and see what happened. Gloria needed emergency care. So they loaded her into the ambulance and drove her to Riverside General Hospital. When the ambulance doors opened, the emergency team saw a woman who looked critically ill, but not impossible. That distinction matters. Doctors and nurses in an emergency room are trained for frightening things. A patient can arrive gasping, confused, shaking, pale, sweating, half-conscious, or with a heart rhythm that looks like it could fall apart at any moment. The job is to move quickly, do the obvious things first, and keep the body alive long enough to understand what is going wrong. So when Gloria was brought in at about 8:15 that night, the team moved into that familiar rhythm. They got her onto a trauma bed. They placed oxygen on her. They checked her heart rhythm. They looked at her breathing. They started trying to stabilize her. Her heart was beating far too fast. Her respirations were abnormal. And because she was agitated and confused, the staff gave medications to sedate her while they worked. This was urgent, but it was still medicine. It was still a room full of trained people doing what trained people do. Then Gloria's heart rhythm became even more dangerous. The staff tried medications to control it, but she was not responding the way they needed her to. So they prepared to shock her heart back into a normal rhythm. A defibrillator was brought over. Pads were placed. People moved into position. And as they worked, one of the staff noticed something strange about Gloria's body. Her skin seemed to have an oily sheen. That detail alone did not stop the room. A critically ill patient can sweat. Whiting can make skin look different. Medications, lotions, and treatments can leave residue. But then someone noticed a smell. It was described as fruity or garlic-like, and it seemed to be coming from Gloria's mouth. That was odd. But again, odd does not mean impossible. Emergency rooms are full of smells. Antiseptic, alcohol wipes, blood, vomit, medication, sweat, and the sharp plastic smell of masks and tubing. A strange odor might be strange, but it is not enough to make a medical team stop trying to save someone. So they kept going. They shocked Gloria's heart. They tried to keep her oxygenated. They tried to pull her back from the edge. Then a nurse drew Gloria's blood. The nurse was Susan Kane. She inserted the needle, drew the sample, and as the blood entered the tube, she noticed a strong chemical smell. Not the usual metallic smell of blood. This was more like ammonia. Susan looked at the tube, and something about it was wrong enough that she handed it to a medical resident, Dr. Julie Gorczynski. Julie looked down at the blood sample. There were strange yellowish particles floating inside it. For a moment, the tube was just an object in someone's hand. A small piece of glass or plastic with blood inside it. But that object was about to become the center of one of the strangest hospital incidents in modern American medicine. Susan Kane began to feel a burning sensation on her face. At first, she tried to keep working, because that is what emergency staff do. In a trauma room, everyone has a job, and if a patient is dying, you do not want to be the person who steps away. But the burning got worse. Then Susan fainted. She had to be removed from the room. That was strange, but in the chaos of an emergency, it could still be treated as one person getting overwhelmed. Maybe she had been lightheaded. Maybe the stress of the room had caught up with her. Maybe it was a coincidence. Then Dr. Gorczynski began to feel sick. She felt nauseated, then lightheaded. She stepped away from the trauma room and sat at a nurse's station, trying to steady herself. A staff member asked if she was okay. Before she could really answer, she fainted too. At that point, the atmosphere in the emergency room changed. This was no longer just one patient in crisis. Now the room itself seemed wrong. Respiratory therapist Maureen Welch was also overcome. Other staff members began reporting symptoms. People felt dizzy, nauseated, short of breath, shaky, or weak. Some had burning sensations. Some fainted. Some felt like their bodies were not obeying them properly. And all of this was happening around a woman who was still dying on the bed. The team was caught between two emergencies at once. Gloria's heart was failing in front of them, but the people trying to save her were now becoming patients themselves. Every instinct in that room said to keep working. But every new collapse made the same question harder to ignore. What was in the room with them? The emergency department went into crisis mode. Hospital staff began clearing the area. Patients were moved out. The emergency room was evacuated. People who had come to the hospital for help were suddenly outside in the parking lot, waiting under lights, while staff tried to understand whether the air inside the hospital was dangerous. A small team stayed with Gloria. That detail matters too, because the story is often told as if the whole hospital simply ran away from one patient. But there were people who stayed in that room even after seeing their coworkers get sick. They kept trying to save her. They continued CPR. They continued resuscitation. They continued doing what they could, even as the room around them became a kind of medical crime scene. But Gloria's body was too far gone. At 8:50 that night, after roughly 45 minutes of resuscitation, Gloria Ramirez was pronounced dead. She died from complications related to her cancer and organ failure. But the mystery of the night did not end when Gloria died. In some ways, that was when it became bigger. Because now the hospital had to answer a question that sounded almost impossible. How could a dying patient make the people around her collapse? In the hours after the emergency room was cleared, the scene looked less like a hospital investigation and more like a hazardous materials incident. People wanted to know if there had been a chemical leak, a gas leak, a cleaning product spill, something in the ventilation system, something from outside the hospital that had drifted in, something that could explain why so many staff members had become sick at the same time. Investigators looked for the obvious answers first. That made sense. When multiple people in one room develop symptoms together, you think about the room, you think about air, you think about exposure, you think about something everyone breathed or touched. But the obvious answers did not appear. There was no simple gas leak that explained it. No clear chemical spill sitting in the open. No neat environmental source that everyone could point to and say that was it. And that made the case more uncomfortable. Because if the room was not the source, then attention kept moving back to the person everyone had been gathered around. Gloria. That was the part her family hated. To them, Gloria was not some poisonous object. She was a human being who had died in a hospital while people were trying to save her. And very quickly, the media began treating her like a horror story. She became known by a nickname her family never asked for: the Toxic Lady. That name was easy to remember, which is probably why it spread. But it also flattened her into the strangest part of her death. It made it sound like Gloria herself was the danger, instead of a sick woman caught in a mystery nobody understood. And while reporters chased the bizarre angle, doctors, public health officials, toxicologists, and investigators were left with a problem that did not fit cleanly into any normal category. Some people suggested mass hysteria. That theory was not as random as it sounds. In medicine, there are situations where stress, fear, and social pressure can produce real physical symptoms in groups of people. Emergency rooms are high-stress places. This was a frightening scene. People were watching coworkers collapse. So officials had reason to consider whether panic had spread through the department faster than any chemical could. But many of the staff who had been there rejected that idea. From their point of view, what happened in that room was not just fear. They had smelled something. They had seen the strange blood sample. They had felt symptoms in their own bodies. Some were hospitalized. Some had lingering effects. And so the debate became almost as strange as the incident itself. Was this a chemical exposure? Was it a psychological reaction? Was it some combination of stress, illness, and coincidence? Or was there something about Gloria's body, her treatment, or her blood that had created a real toxic event no one had seen before? For weeks, the case sat in that uncomfortable space. No answer fully worked. Every explanation seemed to cover one part of the story and leave another part sticking out. Then scientists at Lawrence Livermore National Laboratory began looking at a possible chemical explanation. And this is where the story becomes difficult, because what they proposed was not a simple answer. It was not Gloria had poison in her blood and everyone inhaled it. It was a chain of chemistry, one step leading to another, and even today the explanation is still debated. But the theory started with a substance called dimethyl sulfoxide, often called DMSO. DMSO is a solvent. It can pass through skin easily, and at the time some people used it as an alternative pain treatment, even though that kind of use was controversial. The theory suggested that Gloria may have used DMSO on her skin to help with pain. That could explain the oily sheen. It could also explain the garlic-like odor, because DMSO can create that kind of smell. But DMSO by itself would not explain an emergency room full of sick staff. So the theory kept going. Scientists proposed that inside Gloria's body, or through the medical treatment she received, DMSO may have been changed into another compound called dimethyl sulfone. And then, under unusual conditions involving oxygen, electrical shocks from defibrillation, and the vacuum inside a blood collection tube, that compound may have changed again. This time into something far more dangerous: dimethyl sulfate. Dimethyl sulfate is highly toxic. It can irritate tissue, damage cells, and make people very sick even in small exposures. And according to this theory, the trauma room may not have been poisoned by a gas pipe, a broken vent, or a spilled chemical bottle. It may have been poisoned by a chemical reaction happening in and around a dying patient's blood. If that theory is true, then the earlier clues begin to line up. The oily sheen on Gloria's skin may have mattered. The garlic-like smell may have mattered. The ammonia-like odor from the blood tube may have mattered. The strange particles in the blood may have mattered. And the reason the incident seemed to center on the people closest to Gloria was because they were the ones nearest the sample, the body, and the air around the trauma bed. But this is the part that has to be said carefully. That explanation is a theory, a serious theory, a published theory, a theory that some officials accepted as the most likely explanation, but still a theory. Gloria's family disputed it. Some experts questioned parts of it, and the case never reached the kind of clean certainty people want from a mystery like this. There was no moment where someone opened the cabinet and found the leaking bottle. No security footage of a spill. No single test result that made every argument disappear. Instead, the case remained stuck between chemistry, medicine, public health, and grief. And that is why it has lasted in people's minds for so long. Because the story feels like it should have a simple answer. A woman comes into an emergency room. Staff treat her. Staff get sick. Investigators test the room. Then someone finds the source. That is the shape the brain wants. But the Gloria Ramirez case does not give you that kind of shape. It gives you a dying woman, a panicked hospital, a blood sample with strange particles, a room full of sick medical workers, and a theory that might explain it all, but still leaves behind a shadow of doubt. In the aftermath, Riverside General Hospital had to deal with the practical reality of what had happened. Staff had been sickened. Patients had been moved outside. The emergency department had been turned into a hazard zone, and Gloria's death had become national news. But Gloria's family had to deal with something more personal. They had lost her. And then, almost immediately, the story of her death stopped belonging only to them. It belonged to newspapers, investigators, television segments, toxicology debates, and strangers who would hear the nickname first and the woman's name second. That is one of the saddest parts of this case. Because Gloria Ramirez did not go to the hospital to become a legend. She went because she was sick. She went because her body was failing. She went because the people around her were trying to keep her alive. And in the middle of that very human emergency, something happened that made the room itself seem dangerous. A nurse fainted. Then a doctor fainted. Then more staff became ill. And within minutes, the hospital had to do something almost unthinkable. It had to move the emergency room outside. A quick note about this story. It is based on real historical events, but some scene details are reconstructed for narrative clarity. The chemical explanation in this episode is presented as a debated theory, not a fully settled fact. This episode is not medical advice and is not a substitute for professional medical diagnosis or treatment. This is the SCP Labs podcast.